are in a time crunch, and we're going to get you early on the agenda after we finish introductions.
Okay.
Okay.
That sounds great.
Okay, and I had figured about 10 minutes. Is that going to work?
Yes, that's fine.
Okay.
We need to start Rachel Pereira back up on the 12th. And she's in Monty. Yeah, Pereira, thank you. Yeah, sure.
Okay. Hello, is this Cammie? Cammie
No,
Gilder?
it's Emily. It's actually Emily Fay from the American Diabetes Association.
Oh,
but
thank you. Okay, Emily.
Pop up at Cammie
Okay.
Gildner, so I was just typing that.
You must. Well, that's all we have to work with. So we're glad you are here this morning.
Okay, bye.
Okay, so I think we're going to go ahead and get started, which means we're going to go ahead and start recording this webinar and this session. So I'm going to let Lindsay get that going. So welcome. Happy New Year, everyone. Oh, look, and I didn't even change the year. It's 2015. So we are in the first monthly meeting for 2015 of the statewide CDSMP Collaborative Monthly Meeting, and this meeting is being recorded. So we want to at least acknowledge who all is online at this point. I'm Mary Pat Gallus. I'm with COA, and then also here with me are
Lindsay McIntosh from COA and Cheryl Wakefield from COA.
all right, and I'm going to just go down the list of the screen I'm looking at. So we have Emily Fay. You want to introduce yourself?
Just Emily Fay from the American Diabetes Association, Associate Director of our Youth and Professional Programs.
Thank you. Welcome. Monica?
Hi, this is Monica Wolf with South Central Colorado Seniors, Region 8, and I'm Program Administrator here at South Central.
Welcome. Susanna?
Hi everyone, I'm Susana. I'm the Interim Director of the Health Promotion in Clínica Tepeyac.
Welcome. Vicki? Vicki Kosh? Are you online from Kit Carson? We see her connected. Let's move on to Connie.
Connie Young with the State Unit on Aging.
Okay. Is there anyone else I've missed that I'm not seeing?
Hey, Mary Pat Milligan.
Oh gosh, Susan Milligan. Thank you.
Susan Milligan. How could you forget me?
I don't know. I even greeted you. Susan, tell us who you are.
Well, I'm Susan Milligan, and I guess I'm kind of like an ad hoc member of University of Colorado Health in Fort Collins.
Okay, great. And then I see Crystal Ryder. You want to introduce yourself?
Hi, can you hear me?
Yes.
Okay, this is Crystal Ryder with the Southeastern Colorado AHEC, and I believe Eve Muniz Valdez will be on the call in a short time as well. She'll just be in the room with me. So.
Great. Okay, and we just got up on our screen that Vicki, it feels like she's unmuted, but we're not hearing you, Vicki.
We're showing that she's unmuted on our side.
But we can't hear you when you respond. Vicki, you want to try again?
If you're working through your computer, you might check your computer mic and make sure it's unmuted. I'm testing microphone, she says.
Okay, so we'll let Vicki.
We know she's with us, though.
Say hello when she gets a chance.
And did we do Kim?
And then we have Emily.
She's on Zoom.
Emily, you did some diabetes, yes. Okay. Thank you.
Now anybody else?
Anybody else? No? All right, we're going to move on. I would suspect we may see some more added to this call over the next few minutes. So that's the extent of introductions, other than I'm the 2015 chairperson. So bear with me today, and it'll get better. It's less painful. But in the sake of time, I know we've invited Susan Milligan to share a little bit about her pre- and post data collection that she has utilized up there in Fort Collins. And so, Susan, I'm going to just turn the agenda over to you for the next 10 minutes.
Okay.
This is Connie. Could I just explain why I asked Susan to come, and just in case people weren't on the call last time? Or
Sure, go ahead.
When I had talked with Susan, I did a phone interview with her as part of the sustainability planning, and Susan was very enthusiastic and supportive of the work that she did with the data that she collected, and how that impacted what she was able to do in terms of getting support from other entities. So I wanted to ask her to talk about that some, because when we talked about it last time, people weren't convinced, put it that way, that they wanted to make the effort of collecting the Stanford data. And so I thought that it might be helpful for Susan to talk about that better, more than me. So I just wanted her to talk about her experience, just basically what she already talked with me about, and I tried to convey, but not as well as she could.
All right, sounds good. Take it away, Susan.
All right. Well, to kind of put it all in perspective, working for a health system, and when you're doing programs like CDSMP and the funding to provide those programs, they don't want to hear about how many butts in seats. They want to know about outcomes. How does that affect our bottom line? Stanford surveys, just so that we could say, we have done this here. Yes, it mirrors the Stanford data, but this is what's happening in our own backyard. This is how beneficial the program is for you. And we know that everybody's always tuned in to what's in it for me. And that's how we were able to sell it to physicians, to other groups. So here again, it's not just counting butts and seats. Mm-hmm. It is actually looking at outcomes. How well did it work? And for us in northern Colorado, the most sensible thing was to use the survey that Stanford had developed, and that's available online. It is free. The survey has been tested for reliability, validity, all of those things, and that allows us to replicate clear across the country or the world, for that matter, because CDSMP is offered everywhere. Mm-hmm. So that was our purpose behind using the survey data. And I am one that I'm always looking at outcomes. So you're doing something. That's really nice, but does it work? And for us in northern Colorado, it's like, well, fine, it worked in California, but does it work here? And it's going to work differently with different populations in different parts of the country, different parts of the state. So that was our reasoning behind doing that. Now, we do administer that survey before they start the class, and then 6 months after they have completed the class, we send out another survey gathering the same data so that we can see if they actually did sustain improvements. So we have got a plethora of data dating back to 2003. We can run any kind of report that we want. We can compare demographics, insurance companies, whatever. We can compare a lot of different things. What we have done, the primary selling point is cost avoidance. So went to the hospital and said, here's what we need. We need to know the average cost of an ER visit. Went to a third-party administrator and said, tell us what the average cost of a physician visit is, so that we actually know for our region what those costs are. So if ER visits went down, if and cent value to those numbers. Does that make sense?
Uh-huh.
Okay. As far as time commitment to do that, it does take time to enter that data. But for us, it's well worth the time because we then have data that can back up our claims of why we need to do this program. It has been a huge selling point for physicians, for the hospital at large, for the health system at large, and that's helped us also get grant funding because we actually have outcomes. It isn't just someone else's data. It's what's meaningful to us up here. The survey we use the same questions, but we did have to do a couple of little modifications. One, ER visits. Well, people were including urgent care, doc in the box, those kinds of things. So we clarified that on the survey. Do not include urgent care or walk-in clinics. That way we can separate it from the emergency room, which certainly we don't want people using the emergency room as a doctor's office. So we did that clarification. I would say our completion rate, and I'm speaking off the top of my head, it's somewhere in the neighborhood of 70% that we get back. Ideally, I would love to be able to tie this directly to data that shows hospital admissions, insurance data like ER visits or doctor visits. I think we're getting there down the road. Ultimately, that's my goal, so that we can actually have that data rather than just self-report. We actually know about hospitalizations and healthcare costs. So,
Susan, this is Connie, just to add something real quick, sorry. I wasn't 100% sure you were still going to be on the call, so I didn't send out the survey for people to look at, but I just now, for anybody who's online, just emailed that to everybody I have on my list. That would not include a couple new people today, sorry, but if you have access to that, you can open the link and see the questions that are on this Stanford survey. Thanks.
now the other thing too, they have a survey for diabetes as well as the general class. There's also one for chronic pain. So the different classes or programs have different questionnaires, but there's a common set that is consistent across all of the surveys. So you can compare across different classes, and you can also hone in, say, for instance, on the diabetes class, you can hone in on specific parts of the diabetes information that you want to gather. Like maybe are you doing blood testing? Are you eating this? Are you, whatever it is that's specific to diabetes. So I guess I'm open to questions.
Questions, anyone?
This is Connie again. One of the things I was really impressed with, Susan, is the number of partnerships and that you were able to create is a result, at least a big part of that was the data that you are just describing. Would you mind talking a little bit about those different partnerships and how those evolved and what the results were there in terms of programs you were able to set up?
We recognized early on that the best referral source for these classes are physicians. So we've got to partner with physicians and those entities that are concerned about online. So that's why we went directly to them. We can advertise this in the community, and it's always the motivated people that sign up for these classes. If you have a referral from a physician, if your doctor tells you you would benefit from taking this class, and they're more likely to follow up. Now, what we have done as well, we then follow up with a referring physician and let them know, did they take the class? How did they do? Did they drop out? That gives them feedback so that they know as well how people did. So physicians were the huge group that we wanted to tap into. Any one of those entities, and maybe it's rehab centers where you have people that are struggling. They know what they need to do, but they just don't know how to apply that information. And they consistently come back to rehab, and they're there for a long time. So if we can partner with them, it's going to help them out too. So I think that's probably the key thing. Who has the investment of time, dollars, energy this is going to impact? So who are we really targeting? That answer?
Susan, this is Mary Pat. Was this all part of your job work? You know, part
Yes.
of your hours, so to speak?
Yes.
Okay. And did
Yes.
you have the participants then fill out both forms, both the pre-test or pre-assessment form as well as the NCOA forms that we all use?
Yes.
As far as they started the class?
Yes.
Okay.
I do. So they have a lot of paperwork to fill out the very first day of class. However, when I give them the survey, I tell them to take it home, fill it out when they have, 20, 30 minutes to really think about it, and then bring it back to the second class.
Okay.
But yes, we collect all of that data.
Right. And on the 6-month follow-up then, was that, it sounds like it's, I'm not sure if you implied that the survey gets mailed to them and they respond back to you and you had a 70% return, or do you do a phone call?
Oh, no. Wait. Yeah, our 70% is on those return surveys from what we send out. If we don't get them back, and we do the 3 strikes and you're out sort of a thing, that we'll make follow-up phone calls. We might send them another questionnaire. If after 3 attempts we don't hear back, then they're not going to respond. Sometimes people move. And,
right.
So, but that's very beneficial for us. I think the main thing that people want to know, too, is the self-efficacy piece. And if they do not have confidence to manage their chronic condition, things aren't going to change. So we always see an improvement in self-efficacy. Because the populations are different, you can't compare one group to another. It's more so that they did improve. And you know how we set confidence level at 7 or above?
Mm-hmm.
Typically, we see well above the 7 on the self-efficacy scale if we averaged that. So that's reassuring to me as well. Now, I know this is a benefit for everyone. And if you can sell it on other data from Stanford and stuff, that's great. But I'm just, for our backyard, this is how we sold it, and this is how we sustain the program. But you've got to identify those partners.
Hi, this is Melissa from Boulder, and being in contact and using physicians' offices is something that I think all of us would like to do, but we run into the HIPAA regulations, and I think as a group that might be a good topic of discussion. I know some people are able to handle it with the agreements they have with various doctors' offices, but I think that's really a problem for a lot of us, and it might be a good discussion point at some point, at some point in one of our meetings.
Okay.
Susan?
Yes.
This is Lindsay. I have just a comment about the follow-up tests.
I know that some of us had been originally back in, I'm thinking 2009, 2010, trying to do those follow-ups in person. And that was part of the original design of the program. And it was really hard, as you will recall. And so I know when we've done some research projects and some evaluation work on other using this same kind of system, like I'm thinking the cancer classes, we started doing the same thing you're talking about, that we would mail them out, and then if we couldn't get them, we would try calling, and sometimes depending, you know, on the situation. But we kind of switched to that format rather than trying to do the in-person gathering, and it worked much, much better. And I know that was one of the obstacles to making that follow-up work. So I'm glad you found a way around it.
Well, you know, it's pretty labor-intensive if you have to do one-on-one phone calls.
Yes.
And many people aren't real open to sharing information and stuff over the phone, whereas they're more open to filling out a questionnaire and sending it in.
Absolutely. And there's a lot less cost involved for the program.
Exactly. What we tell people the very first class, we are collecting information. It is strictly confidential. You are assigned a number when we enter your data into the database. You are a number, and none of your information is released other than the results of what you filled out on your questionnaire. This has been real helpful because we let people know we are able to provide this wonderful course to you freely because of the data and the information that we collect. So that's how we sell it.
We're getting some static or deep breathing or something on the phone, just so you would know. You can move your microphone away from your face a little bit. Whoever. So let's 1 minute, and we'll kind of wrap this up. Any other questions for Susan?
Connie, again, just a comment that I was very impressed when I first heard about all the work that Susan had done and the success that she had with groups that Ellen sent me, which were the University of Colorado Health, Marymount Health Club, Associates in Family Medicine, and Colorado Health Medical Group. So there may be others, and then she also got some grant money from a large private foundation. So quite a good track record.
You know, if I might say one little thing, and then I'm going to need to scoot. The Marymount Health Center, they have partnered with the school system to provide a wellness program, and that is part of the wellness program. So, you know, think outside the box. Here we have health clubs and insurance companies and all kinds of different agencies and organizations out there that we could partner with. And the selling point on this whole thing is we're going to save you money.
Right. Well, thank you so much, Susan. Appreciate it.
Oh, you are so welcome. And anytime, just let me know.
All right.
Thank you.
And then I jotted down about maybe some follow-up at another meeting about HIPAA compliance with referrals. So I noted that as well, Melissa. I'm going to move on to the next thing on our agenda. I hit the wrong button.
Bye.
Bye-bye, Susan. Okay. So this is for Connie Young. I know Lindsay Blackwelder is not on the call today. So Connie, an update on our year 3 of our grant?
Yeah, I was just looking to make sure there's not a, okay. I think that we have a confirmation for the data presentation. I was looking to see if I got another email from Wendy later about changing something, but I think that was something else. So you all should have received, and then I will add the people who are new to the call, that that we have hired a consultant to help us with developing a business and sustainability plan to keep CDSMP going long term. The grant funds are scheduled to end next August, and a lot of people have some other funds that they're able to tap for classes, which is great, but people also seem to rely a lot on the grant funding. So that process of developing this plan is underway. We're getting toward the end of that process, at least with a consultant. So they've been doing interviews, and I've filled in with doing some interviews and some written surveys of the area agencies on aging, other states that have Medicaid, and the consultant, which is Maryland Nonprofits, has been doing interviews with people in Colorado primarily, and to assess, where we are, what we need to do, what the possibilities are, etc. So we are planning to do they will be doing the presentation of all that information, scheduled for next Tuesday. The invite has Eastern Standard Time, so I'm going to see how that shows up on my calendar. Sometimes those show up as Mountain Time. Actually, it's not showing up at all yet, so I'll test that, and if it shows up at 3 o'clock on our calendars, then I'll ask if we could send another one just to make sure everybody has the right time and doesn't miss it. But that will be a conference call, and we will be also able to record that. So if you can't make that one time, then you hopefully have some time to listen to that before our in-person meeting, which is the following week, and that will be when the consultants they've presented the results of their research, and then at that in-person meeting we'll be looking at where do we go from here, and there'll be a lot of interaction with all the people who are there. So I'm really excited about that opportunity, and that will be our last formal communication with the consultants. So the best representation we got was for Wednesday the 21st. It will be an all-day meeting from 9 to, I think we scheduled it to 4 o'clock. It will be again in downtown Denver. I looked for a lot of different meeting rooms that were outside the metro area in case people, had a preference there, but it's tough to find meeting rooms, especially when you don't want to pay for them. But anyway, that's where that is, and appreciate all the responses you have given to the many polls about when you're available, and hopefully even more people will be able to come to that meeting next week. In 2 weeks.
So Connie, next Tuesday the 13th, what is the actual time of the meeting?
It's at 1 o'clock.
Okay, great.
1 to 2, I guess they were going to do 2 hours, so 1 to 3. Thanks for clarifying that. Any questions about that?
Go ahead, then. Go ahead. No? Were there any other questions for Connie, just in general, about we've now started up our year 3? Everybody good to go? That's good news. No news. That's good. Yeah, well, I think we finally all figured it out after the 3rd year. All right, so Lindsay, just a quick update on our centralized referral system and our website. An apology, I guess. We had intended to do some of the collaborative updates over the break, and our IT person is also my husband, as many of you know, and we had a death in the family, and it whacked our holiday season. So the downtime that we had planned on using for this evaporated. So it is still on the to-do list and is coming up quickly. He's finishing a project today, and then we should be able to get those changes done. So my apologies for that not happening. In terms of the centralized referral system, in conversation again with Colorado Access to see if we can start the process with them on referrals through the collaborative website, and that is about it. Okay. Questions, anyone? Okay. Our next topic is our regular agenda item, and that's usually Kelly McCracken presents any kind of updates, and she also is not able to attend today and didn't really have any information, any news to share as far as any data entry or submission updates. So I think we're good to go as far as that topic. Our next topic, I think, Connie, you sort of touched upon this now, the update on the sustainability. Is that, have we covered all of that?
Yeah, I think so. Yeah. Yes.
I kind of noted that you went into that, so that was great. Looks like we have some other people in there. Yeah, we did add a few more people on the line. Greg Smith, you want to introduce yourself?
Sure. Sorry, I had you on mute there so I could do other things while I was listening in. This is Greg Smith. I am the manager here at Aging and Adult Services for a variety of things, including data, legislation, and budget items. And I supervise Connie and have tried to attend some of her meetings and be a little more involved in the CDSMP effort so that I can hear all the good work that you guys are doing.
Great. Welcome. We're glad to have you on the phone. I also see Ellen. You want to introduce yourself, Ellen? She's muted. Looks like you're muted. I'm going to move to Melissa. You want to go ahead and introduce yourself, Melissa, who you are and where you're from?
I am with this is Melissa Pruitt. I'm with the Boulder County Area Agency on Aging. Thank you.
And you don't sound well.
Cold. Good old travel cold.
Okay. And then, as I mentioned, Ellen Pilstrom, I believe is how you say her last name, is from the University Health System up in the Fort Collins area. She, as many of you know, replaced Susan Milligan when she retired. So that's who she represents. And if she has a chance, we'll later introduce her. And I think I caught everybody at that point who was added. So our next topic, which I'm glad to see we have some time to address this, because Connie's done a lot of homework on gathering information and so forth. So we want to talk a little more again about our marketing discussion and particularly all the different names that are being used. And Connie, I'm going to let you go ahead and lead that since you've done some work on that.
Okay, thanks. Well, the issue that's with the various names that people use for in Colorado for the chronic disease self-management program has there's been feedback from some of the license holders about concerns about the difficulties with trying to explain what a program is when it's got a different name and many different names, that some of the issues with looking on the website and getting confused about which class is which. My marketing background includes the general practice by organizations of doing branding, which at a very basic level involves using one name for everything. And it's interesting that out of the 22 states that have CDSMP, there are only 4 that do not use a consistent name, and we're one of them. They all use different names. I got the list of who uses what name, and they at least several of those names there. They're all different from one state to the next, but within those states, they all use the same one. So that's why I wanted to tackle this issue and get as much input from everybody as possible through email, because not everybody's on the calls. So we did get good response, and I appreciate that. Some of it, a lot of it was just yesterday, so I didn't I wasn't able to get the list of all of the feedback out until after business yesterday, so hopefully you have that by now. But if you haven't had a chance to look at it, the main issues that I saw just in terms of summary is that almost everyone was either willing or actively supporting using a consistent name. Most people didn't care or didn't have a strong inclination that they wanted to use a certain name versus another. They're open to ideas on that. Several people gave some specific suggestions on ways to do this because knowing that COA had some concerns about changing their name that they've trademarked and been using. And so other people made suggestions about, well, could we use different names but have one tagline that would at least identify and create some consistency there? Could we use different names paired with the spelling out of CDSMP, for example, healthier living, a chronic disease self-management program or something like that, as well as Be Well, a chronic disease self-management program, that kind of thing. There was also a good point made about the diabetes program, and for those of you who have worked with that program and worked with hospital educators, there seems to be an inherent conflict with what we are doing and what they're doing and how to distinguish one from the other, so there's less a perception of competition. So that would be something that would be good to try to address in that terminology, to try to make as best a distinction as we can between those two programs. There also was some feedback about trying to create a catchy name, which is one of the reasons this was brought up to begin with, because of the kind of the negative connotation of the term chronic disease, which some people, as one of the people commented, some people don't consider themselves to have a chronic disease. Probably, in my opinion anyway, most don't want to, even if they do. And then we're also trying to reach the disabled community, and unless they have a chronic condition, if they look at the name and see chronic disease, without an additional explanation from somebody, they would most likely say, well, this doesn't apply to me. And that would be the end of the conversation or end of their pursuit of trying to enroll in the program. COA also, let's see, had made, and I'm paraphrasing, Lindsay can add to this, but basically that they're feeling committed to their name and do not want to change, but would support, she said, would support discussing the other license holders using the names we have trademarked. Some people didn't want to use the same name, but so there are a lot of different issues. I think that it's probably going to be impossible to come up with an ideal situation, but I'm hoping we can come up with something that will address the concerns that everyone has in the best way that we can. Did anybody want to add to comments they made or something else they've thought of, or if there's anyone on the phone that didn't? I think there are some people that didn't respond to the survey or my email that want to add their perspective on this.
Connie, it's Lindsay, and I wanted to just add in some input. I know Lindsay Blackwelder couldn't be on the call today, and one of the things that is sort of the history behind some of this is that we weren't involved with the Be Well renaming when that happened back in 2010 or 2009, I believe. There was a decision that all of the classes would be offered under Be Well and that there would be common branding and marketing materials and things. And what Lindsay asked me to just mention was that it was, there were a lot of programs that had a lot of, that weren't comfortable with that and weren't comfortable with having to use a name that was not one they had originally come up with, and not comfortable with the commonly branded materials. And so Lindsay just asked that I reference that for those people who had not been through that process once before, that that is an issue and may have some effect on how we move forward, because there is considerable cost involved to someone somewhere in branding everything the same across the state.
And if I could clarify, Lindsay, thank you for that history about, Lindsay's talking about a previous grant, federal grant for CDSMP. And I used the word branding, but probably shouldn't have, because that implies much more than I'm talking about here. I'm not suggesting that we need to have consistent materials across the state, just trying to address the issue of the name. And there are some examples of what some of the issues people have come across when there are different names. And I had one of those myself when I was doing the interviews with the AAAs, the Area Agencies on Aging, about their interest in CDSMP and what keeps them from being more involved, what would help them get more involved. And one of them said, well, we don't even have that offered in our area. And then I looked up and found that it was offered, and he was looking at the website, and he says, all that agency has, or that organization has, is blah, blah, blah. And that particular name was actually one of the other names for chronic disease self-management programs. So it took some explanation that that was the same thing, and the question was, they're following the same Stanford model, and yes. So anyway, that's just another example of how that creates some challenges. I'm not hearing people objecting to that now, though, other than, as you've mentioned, Lindsay, with your commitment to your name. If others don't agree with that, they haven't responded to my emails. We're getting some music in the background.
Yes, we are.
Maybe somebody has us on hold.
Yeah. Okay. Instead of mute. Yeah, and I think one of my thoughts is that in some areas we have not been able to do a really great job yet of explaining the idea of the collaborative, and I think AAA directors is a good example in that the AAA directors who are involved with us either as license holders or as partners are aware of what we're doing. I don't know whether there's been a chance for anyone to talk with, for example, at the AAA state level meetings about the collaborative or what the collaborative does, or that many names all refer to the chronic disease self-management program. And so I think some of that is maybe a name issue, some may be an education issue, and I don't know which it is. Just throwing that out.
I have
something I want to just add. This is Mary Pat, and I was thinking about this last night. Is that even within our partners, I got to thinking that even if we go into, say, for instance, Eagle County Public Health, and we call it Healthy Living Colorado, they've actually renamed it themselves because that's what fits for their community, and that was their buy-in. And I have to believe that that's part of the success, is allowing them that opportunity. So they put it into their Well and Wise program. It's still considered, the Stanford model of CDSMP. Everyone knows that, but it's even got its own name within our structure. And then we partnered with Lakewood and Centura, and they call it Healthy Lakewood. And we partnered, we partner with Longmont YMCA and Salute, and they call it Activate for Life. So I do think there's that tendency, regardless, for ownership and identity. And I think the ones that we have that are very successful actually kind of take it in and sort of give it their little stamp on it as well. So it kind of goes down a couple layers. And so you could be in Longmont at the Y and not recognize that Activate for Life has the 6-week Stanford class with, embedded within it. And yet it does, and it works very successfully for them. So I mean, just what's in a name? It's a big global question. And I think it does sometimes require some additional educating. You're absolutely right. And sometimes you have to explain that it's like another class that's in a community. We run into that a lot since we serve statewide. And, as a collaborative, it's great that we can then refer folks to the other class. We can say, oh, that's the exact same program. Send your patients there, or feel free to take that, or get on the self-management website, and you can see the classes, the exact same class offered all over. But, there's some challenges with that. I would be remiss in not saying that, but again, it's interesting how it kind of goes down layers even, with them wanting to try to take it in and identify it, and they say, well, this really fits nicely in this program for us in Sterling. So we're trying to be flexible as well.
This is Emily from the American Diabetes Association. I know that I've been MIA for a while, so I may be speaking a little out of ignorance.
We didn't hear who it is that's talking.
It's Emily from the American Diabetes Association.
Thanks.
So the only upset, and this might be working and I might just not be knowledgeable about it, is we talk about how important it is for people to be able to refer to this program or refer to a website or really get that marketing component out there. So A, this is the question, are currently all the DSMP, CDSMP classes housed on one website that clearly says this is the Stanford model of this CDSMP? Because I think if we all try to take ownership and name the program, something that's more applicable to our community, it then becomes hard for a doctor to say, oh, you live in Lakewood, this program is called this in Lakewood, and this program is called this in Littleton, and it's called this in Aurora. It just makes it really hard to identify with one specific.
Well, just an immediate response, Emily, is that we do have the Colorado Self-Management website. So it's called Colorado Self-Management, and that is the site that all, selfmanagementcolorado.org and .org, selfmanagementcolorado.org for those of you. And that is the site where all of the classes throughout the state, and we ask all license holders to submit their classes to us, and we'll post that as soon as we get the information. So there is a one-stop shop, and it was a need expressed early on with this collaborative of needing that kind of a thing. So once you go into that website, it will describe the different classes. They are called chronic disease self-management. They're called chronic disease self-management diabetes, the standard kind of Stanford names. But then as you go down and you scroll and you pull up Aurora, then it might say, this class is called Be Well, and it's held at such and so on these dates. And then a class in Eagle is called something else. But it is in that one website, and it'll say, why the names, that the names correspond to the appropriate category, if that makes sense. So it does make it easy for a doctor, as you're saying, to pull up that website and see them all, regardless of their names.
And it allows referrals through that one site as well, so that if you are looking at classes, descriptions, you can pull down, the pull-down menu basically gives you the options of the chronic disease self-management program, diabetes self-management program, et cetera, in the official Stanford wording. And then as Mary Pat said, if you are looking, for example, in Greeley, Colorado, let me pull up a diabetes one here.
Can you say the website one more time?
Selfmanagementcolorado.org.
Good question.
And then if you look, Emily, under classes, you'll get something that says, what course are you interested in? And that's where you can choose which one. It'll then give you the location by city. And then when you click on the information that is specific, let's say you want to do a class in Greeley, in diabetes, or whatever, it will then give you the specific contact information and reference what that program is calling it.
And the way that the first level, though, is if you're looking at the website, or as Lindsay is explaining, when you go into the what class are you interested in, the names that are given use the chronic disease terminology, which has been identified as a negative to begin with, not just by me but others.
But that would be the common ground at this point, which is why it's done that way. So then if you look, for example, if you're looking at the class in La Junta, for example, and go to details, it will tell you that that one is a Healthier Living Colorado Diabetes. Sorry, what do you think?
They're asking if we can type in the website.
I will do that. I have to go.
It's on the last. It is. It's on the last page of the slideshow, incidentally, the website.
Okay.
Could we hear from some of the...
You asked about it.
Oh, sorry. I know that there is at least one person, I think it was Crystal and Eve, that might not be able to stay for the whole call. I don't know if they're still on the line, but I'd like to open it up to the other folks around the state that had provided some feedback or have questions. Crystal, are you still on the line?
I am still on the line, yes.
Would you like to provide any comments or additional perspective? Or
You know what, looking over the comments, I really liked the last one, number 10, where it says, I like Healthy Living Colorado. As long as there's no other programs that are called that, I believe we should all be using the same name and take out the chronic disease, ongoing condition jargon. I tend to really agree with that, just because of how whenever we have where it says chronic disease in there, people don't necessarily identify with that, like you just stated shortly ago, Connie. I think it is good to, I mean, we're only one of 4 states out of 22 that don't have a consistent name. I think it would be beneficial to have a consistent name, but then I also understand for those that have really put money into acquiring their brand and marketing. So there's a lot of points both ways that I really understand, and I don't know that I went any more to the discussion, but I do really like that comment number 10, because I think that said a lot of what I was wanting to say in a lot less words than I wanted to say it. So
thanks, Crystal.
You're welcome.
Is Eve on the line too, or?
You know what, she wasn't able to make it in here. She's in another meeting. So.
Is there anyone else that needs to leave early that we should invite to talk next? If not, then whoever wants to chime in, go ahead.
This is Melissa, and this has been something that I'm really happy that we're having this discussion, because I feel like there's, just hearing the comments, we may not be able to come to an agreement, but maybe we can, at least as a collaborative, make a recommendation of what we think would be good. And my goals in this was to just clarify what the program is and give it the opportunity to be identified throughout the state. So here, you know, a couple of conflicting things. So if we don't want to use chronic disease in the title because we feel that that's off-putting to some people, that may be true, but if we are trying to get physicians to refer to the program, them knowing what it is and maybe have heard about Stanford's program probably helps them identify the program as opposed to Be Well or some other name. So my suggestion was to just, you know, somewhere in there, it can be an asterisk, it can be anything that we want, to just say this is the Chronic Disease Self-Management Program and then call it something else if we decide that that's a better idea. Mm-hmm. But I think it would be helpful if we somewhere in there identify what this program is so that physicians and others who've heard of it can make that association. So that's my comment.
Okay.
Connie.
Thanks, Melissa.
Hi, Connie. This is
Pat, I
Monica.
had a suggestion.
Monica, I think. Okay,
Maybe
Monica.
we needed to relook at our website. Perhaps if that's the general point of reference that all of us can tap into, is there some different way we need to, you know, lay it out or jazz it up or change it so that it's a little more all-inclusive? If that's a piece, I mean, that's a common tool that we all share, and I'm wondering if that's a place to begin to look at on this whole marketing/branding sort of concept. Rather than getting into everybody's individual name, are there ideas on our website we could incorporate?
You mean in terms of naming?
Yeah, whether we name it, the way it pops up, does it look different? Does it?
So the scroll down would have chronic conditions, managing chronic conditions or managing diabetes, rather than chronic disease self-management program.
Mm-hmm.
Right. Would that be a way? Is there more wording we need to put in on that front page? So if we're all asking physicians and providers to refer to that website, then what would we all like to see on it that could kind of pull us together? I don't know. I'm just thinking one tool that we all have access.
Right.
And we talked about it.
I think Monica was
wanting to changing names, as Melissa alluded to, a tagline that, whether it was the primary or a tagline that identified that we were all in a collaborative, that it was, you know, a statewide chronic disease self-management collaborative, or even if we called it the self-management program from Stanford, or whatever we came up with, so that we would have that in common.
Okay. And Monica, I think you were wanting to make a comment.
Yeah, Connie, I didn't get anything into you. I've got some personal stuff going on for the last month or so, so I've kind of been out of the realm of things. But well,
you can give
anyway,
that now.
Okay. What we did was, what we've been kind of doing is, instead of just going in we've just kind of been throwing it out there, you know, kind of as a question, you know, do you have chronic conditions? And then we put self-management workshops, or, you know, just to kind of stress what we do instead of kind of who we are. And then what we do is afterwards, you know, a little blurb about what we have to offer, you know, and then at the bottom we kind of put, you know, what they are, and they're offered by Stanford, that type of thing. And so hoping that, you know, they look at the thing and just say, well, you know, okay, yeah, I do have a chronic condition, and there's self-management, you know, instead of them looking at, okay, this is what it is at the beginning, like Be Well Colorado or whatever. And we do specify, you know, chronic disease self-management programs, that kind of stuff, but we do it at the end. And so because, you know, of course we want to catch their eye. And so number one, this is what we have to offer. We've got self-management workshops. And, you know, do you have a chronic condition? Well, yeah, that's going to catch somebody's eye, I think. But then also, another thing, too, is through the hospital, because we've collaborated with the hospital, which, you know, you all know, but they have referral forms that, you know, they send out to all the clinics and that type of thing. And I was just reading number 5, where it kind of talked about, you know, some of the issues that they get into, like with like diabetes educators and that type of thing. But on the referral form, I know a lot of the docs, and one doc in particular told me, get on that referral form and put yourself in there as what you do, self-management. Because a lot of people go and they go to like our DEEP program, and the DEEP program for us is, you know, they go in and they learn the nutrition part of it and that kind of thing. And then, of course, they do see a diabetes educator, and so through that they learn how to test and all that kind of stuff. But then the third step would be self-management. And that would be kind of the third and final step. And then that way, the docs can look at it and say, well, yeah, they've been through this, and they're still having problems. And, I mean, really, people just want to know, okay, what do you do? Well, this is what we do. We help self-manage your condition. We're not trying to take over, but you've already been through the steps, and so we're here to help self-manage on a day-to-day basis. And,
okay.
So we had a Kroger or City Market in our area, but they're one and the same here. They contacted us, and they were looking for to see if we wanted to advertise on their bags that go out on their prescriptions. And so we went ahead and did that. And so it's kind of the size of a calling card or a calling card. And that's what we did. We just asked the question in big black letters, do you have a chronic condition? And then we put self-management workshops, and then under that we put, chronic disease for those that have one or more, and then diabetes specific, and then we go on into it. And so hopefully by just doing that, it'll catch their eye and say, yeah, I am interested. But that's just an idea just to say what we do instead of really who we are until, and then you can list that afterwards. But I don't know.
Okay.
Stop there.
This is Eve. I just wanted to chime in. I know that Crystal had made a comment earlier about that Healthy Living Colorado name, and I tend to agree with her. I think that because I've been in nursing for a very long time, it's a little bit easier, I think, for people in the health profession to figure out what some of the names mean, but for people that are, for the consumer, I think sometimes some of the titles do get confusing. So I guess I'm thinking along the same lines as Crystal with the Healthy Living Colorado, but we've tried to really explain to people. I think when we talk about chronic disease and self-management, people don't know what that means. It tends to be confusing for them. So yeah. That's just kind of my 2 cents.
Okay, thanks, Eve. Others? Who else would like to chime in?
Emily, that just was speaking. Connie? Is
Sorry?
that Emily? That was just speaking and said she was identifying with what Crystal had said?
I think that was Eve, wasn't it?
Was that Eve? Okay.
Was that right?
I thought Eve wasn't on the call.
I'm sorry.
Sorry.
Say that again. I didn't hear that last piece.
Who is it that's speaking now? Is that Emily?
That made the comment about agreeing with what Crystal said. We weren't sure who that was.
Eve.
Eve. Okay. Sorry, I thought you weren't on the call. My apologies.
What other thoughts do folks have? Agreement, disagreement, suggestions, anything else? Well, I have a couple thoughts. I really, really appreciate all the thoughtful comments people have made. It's clear that everybody's really thinking about this and wants to come up with something that will work. A couple thoughts I had, if we want to, I think all of these ideas about how to incorporate some ways for different groups to identify with it. Eve was just mentioning consumer, sometimes the audience matters, and if we have one way of, pretty much one way of providing information to people, in terms of materials, if it's a website, if it's a brochure, if it's a flyer, an ad that you're doing, that you might want to have language that consumers would understand, and something also, maybe the sort of the caveat or additional language for the medical community that you're mentioning, there's a few people mentioned using, referencing the Stanford program, which I doubt that anybody would disagree with that. If we still want to start by seeing if we can address the name issue and then incorporate these other suggestions along the way. It seems like there might be two options. Like I said, when I first excuse me, start talking about this, I don't think there's an ideal solution, but a fallback might be either if we consider or have COA talk about the circumstances under which they would consider letting everybody use their name, even though everybody doesn't want to do that, but maybe they would go along with it. The second option I was thinking of is, now we have many different names, and maybe we could at least boil it down to two. And COA could use the names that they have for the various classes, and we could come up with something else for everybody else. So if you're referring to a class in another area, you could say, well, in that area it's called, I'm sorry, Lindsay, what do you use? Healthier Living Colorado?
Healthier Living Colorado. Mm-hmm.
Okay. So you're saying, well, there's one in Lakewood, but it's called Healthier Living Colorado, whereas in our area it's called something else. So that was my thought, that if we did one of those, that at least we could try to tackle the name issue as best we can under circumstances that we have.
Connie?
Yes, is that Monica?
Hi, yeah, it's Monica again. Yeah, a thought to that also is, even if we did, because I think everybody likes the Healthier Living Colorado, or Be Well, either one. But if we could maybe even, just a thought, use that as like a main logo or a main name, like if you put out flyers or if you put out letterhead or anything like that, and you use that as the main logo and the main name, and then underneath, then you could go on, if you want to be more specific to your own community or whatever, but then the logo or the main name is the same. And then you could fall under that with what you feel is comfortable for your community.
Mm-hmm. Well, that's an idea. One of my challenges at this level is we're not just doing outreach at the local level where you have an opportunity to explain things and explain what your name is, the name that you use, and develop some identity there. When we're talking about the business plan, sustainability plans, statewide efforts to support CDSMP, I have to have some way to refer to it. I can't provide 10 different names, it's too confusing. So that's the hindrance I've had with doing really anything other than with the medical community, where they don't object to something being called a chronic disease program, even though that still excludes the disabled community. But that's one of the challenges I have here with our whole effort, which, as I mentioned earlier, we're spending a lot of time and effort and money to address. It's like, what do we do with it? How do we explain it? So that's a challenge for me. But I appreciate that suggestion also, Monica. Thank you.
Connie, I had a question. Do you feel that after this year 3 that there's going to be further funding opportunities and having a common name is important for that?
I would hope so. Yeah. I mean, that's what the sustainability plan is about. That's why we're developing a statewide sustainability plan, and why the consultant provided the webinar for people to develop their own local sustainability plans, because the efforts, the outreach, the community is different. So I would hope that we would be able to put together a way to communicate about the program to other people on a statewide basis. to insurance companies, to employer groups, to Medicaid, to other stakeholders that maybe there's grant opportunity as on a statewide basis. But yes, the answer is yes.
Okay. I was just thinking, I know here at COA, we obviously use Healthier Living Colorado, and then we have to sometimes explain to our funders that that is the Stanford model. But it hasn't kept us from getting money, having that name that doesn't say chronic disease self-management. But of course, it's that evidence-based Stanford model that many of them want to fund or support. So I was just trying to think if that's having the same name as a hindrance to our funding opportunities.
Well, it may not be for COA. I mean, it was mentioned on another call that you're the largest license holder in the state, and I think you have the most success with getting support funding classes. But it's not, the collaborative is a whole collection of people. And most people, a consumer doesn't care that there's a collaborative or even know what we're talking about. Right. I think a lot of people don't care about that if they just want to get somebody into a class, and we don't have a catchy name for the collaborative either. So, it's just that it's not about just one license holder. And that's
oh no, I know that.
That's the challenge that I know it hasn't been an issue for you, but it sounds like it has been for other people. Yeah.
Okay.
Would people want to explore the two options further that I mentioned as a fallback to creating one name that everybody likes and adopts, to either develop a one that everybody else could use and COA can continue using their own, or we have COA talk further about everyone else using their name? Would you, not that you have to pick one or the other right now, but is that something that, and then again, we still would address the other many good suggestions that people made about that are more specific about how to incorporate the terminology chronic disease somewhere, and clarify the diabetes issues and et cetera. But what would you think about looking further into those two options? Would people be up for that, or do you not like either option, so you wouldn't want to do that, or what do you think?
Always open to processing things. I think it's important to process things. I think we just need to be aware that we're not over-processing things. But I mean, we want to work with people and do what's best for everybody. So I mean, we're open.
Okay.
I think being open to it, I mean, I'm open to it also. This is Monica. Just to, to maybe decide on two options and, just make a decision, I guess.
Is it possible to talk more about it when we're together at the day-long session, so we can talk about what the pros and cons would be when there's more of us in the room, or maybe to give people an idea of how it would operate, or what I just am wondering if we would be better off continuing to discuss it when we're all together.
I think it would be great if we could do that. I don't think we're going to have time during our planning meeting. I need to talk to Wendy about how they're organizing that, but it is a kind of involved discussion, and I think it could take a chunk of time. But I will look at that, what we've got, and see. You know, I do agree, Lindsay, it's easier, but, you know, if we don't do it there, then, you know, we don't get together again for another 6 months or something. So I think it, you know, it works. I think it worked pretty well to offer everybody an opportunity to respond by email, even if they couldn't attend the meeting or didn't attend previous ones, and then to do as much as we can by phone before and after that. So again, it's not ideal, but it may be what we have to do.
This is Emily.
Would you want to put together sort of a subcommittee, and you've already seen some interest?
I'm sorry.
To meet, yeah, separate from this time, because I mean I know we're at 10:20, and it sounds like, you know, there's definitely some interest in looking, maybe a consideration of the option of the 2 names perhaps, and then also what that name would be, that second name, and or if COA could incorporate others using the Healthy Living Colorado. So maybe a little smaller committee that would want to have some phone time on that.
Yeah, or just a separate effort. I hate to exclude anybody because of the investment that people may have, but yeah, we might be able to, might be better to do that. I think there was someone else, was it Emily, that was wanting to comment?
Yeah, I was going to say moving forward, I think it's going to be important to identify who our real consumer is. Is it the providers that are writing the prescription for the CDSMP, or is it the actual public? Because it might not need to be so fancy-dancy if it's going to be something that providers are just handing over to patients. So who are we actually targeting?
And maybe who through what channels, because you're right, it is what you need to emphasize for one group is different from the other. So do we do something separate for each one, or do we, is there a way to
Well,
incorporate?
it is our ultimate goal to have every clinic and hospital and CDE across the state know about this program and pushing it on their patients, or is it our goal to make these PSAs and public awareness campaigns to try to get people to self-select? I don't know.
Okay.
And I think that's a combined effort that we face all the time at COA, just what you're saying, Emily. I mean, you know, we have a marketing specialist who's working on that very concept and, you know, developing materials that might be applicable to a provider and materials that are more applicable to the general public. So you're absolutely right. I mean, right now we're kind of hitting both sides of it in our own marketing efforts. So it's a real question.
Mary Pat, I have a quick question. So your trademark is Healthier Living Colorado, is that right?
Correct.
And so it's
Tomato Control Colorado.
Okay, and so is Healthy Living considered different?
Ours is trademarked as Healthier Living Colorado.
Okay, so Healthy Living Colorado would not be an infringement on your trademark, is that right?
No.
Okay.
No.
Okay, well that's just something for consideration because they're similar but not exactly the same. So we might could do something, you know, very similar to that and make it easy so that you don't have to give up your name and others can that liked that one could use it.
Well, I think that's kind of confusing though in and of itself. Is it because then people are going to be wondering if we're just typing it wrong. Healthy living and healthier living. But I you know, like I know Kaiser for a long time has used Healthier Living, managing your ongoing health condition, as opposed to ours, Healthier Living Colorado. So I think there's a lot of different, you know, variations in there, and so the question is, does that make it easier or more complicated? I don't know.
Yeah, and I don't think any of us do, but just trying to.
Yeah, exactly.
Yep.
Well, I like the discussion, and I really appreciate everybody's input. Would we? How about if I send out an email asking people for whether they, you know, want a smaller group to look into this further, or if we should keep it open to everybody. I mean, it's not a really huge group anyway, because not everybody participates. But and then we could look at, unless anybody objects to considering one of those two options as a starting point. Does anybody object to that? Right off the bat, a couple people said they'd be open to it.
Mm-hmm. I think that's a good idea.
Yeah, I think definitely open to it, and I think we still want to have some discussion around the why and how we want to use it and what we want to do with it if we are asking license holders, any or all, to change how they're doing it, what that entails and what all that means.
Okay. Well, I will follow up with another email, and I understand the issue about not wanting to overprocess. I think some people don't really care; they just want an answer, and others, and I understand that. Me too. But it does seem like some. I don't want to alienate people by doing a vote and just moving forward without having more opportunities for input into the process, but I definitely appreciate everybody's involvement, so I will follow up and go from here.
Well, thank you, Connie. You've done a lot of groundwork on that, and appreciate it, and appreciate that summary of the different names you can see on your screen, and then getting the input and sharing that with us all. It definitely catapulted this topic, and I think that's been helpful. It looks like we'll have some continued work on it, but maybe really begin to fine-tune this now, which is, I see a little light there at the end of that tunnel. That's a good thing. So
Yeah.
I'm going to move this along, and we were able to give that some good amount of time for discussion. Just want to post here, you see what we know as the upcoming updates. Does anyone have something they know they want to share over the phone, any upcoming trainings?
Keep in mind that part of year 3 are some scholarships for partial training. So if you have folks that are needing community members or agencies you're working with that are looking at needs and training, this is a good time to fill out that paperwork from Connie so you can get them into classes.
Yeah, and let me know if you're interested. And just to clarify, that would just apply to COA's training, because I believe Alamos and Greeley offer their training at no cost. I don't think Holly's on the line, but I believe that's the case since they're both area agencies on aging. Is that true for you, Monica?
I'm sorry, what was that?
I was just asking, I was just saying that I believe that you offer the leader training at no cost to people who would want to come take that, who are outside your area. Is that right?
Yes, absolutely. And then also, Connie, on ours, I think if they do the diabetes, the 2-day crossover for diabetes, it'll run through the 31st.
Oh, okay. So maybe.
Okay, so that date needs to go to possibly to 31st.
Right, because it'll be the 2 days after.
Okay.
I should also mention that
that is the 30th. Because it's 25, 26, 27, 28.
And you know what?
29, 30.
Yeah, we were just counting. It's January 25, 6, 7, 8 is 4 days, and then 29, 30 would make it the extra 2. But is that not how it's set up?
Well, it's actually the 26th through the 31st.
Okay, thank you for changing that.
And just so you know, the Tomando Control de Sus Leader Training is underwritten in part by the Colorado Community Health Network. So if we are training folks that will be doing classes in areas that will be receiving referrals or working with people in community health centers, which is pretty much all of us, then the training is free of charge.
Great. One other thought that I had on this is that I can, for Holly, who's not online, but Monica, if you if you do end up having, or well, anybody who might be interested in sending people to the training, to a training in what we have now is Alamosa or Greeley, if you're from out of that area, I could also look at possibility of paying for their travel costs, because I know that sometimes is a challenge. They're coming from another area that takes a lot of money to stay somewhere and travel there and get have some sustenance while you're there. So I think that that is a possibility with the grant funding that I have to pay for that portion of it.
Okay. Connie, because I know we have a couple people, maybe even, well, a couple people for sure, I think, that are interested in the commando control in March. And they are actually from the MEP program, the Migrant Education Program. And there's a couple people that are really interested in becoming leaders in the commando control, which would really help us because we don't really have anybody that does the Spanish version. Mm-hmm. And so would that apply to that also?
Yeah, probably so. Give me touch base with me afterward, because I could see where that would be tough for you to afford that, or for them to pay for their lodging and all of that. So I think that would be a reasonable request, yeah.
Okay, thank you.
Just so you know, how we're figuring out where we're going to do that training is based on where we have the most interest. So we know, for example, Monica, that there is interest down in Alamosa and also La Junta and Durango and Trinidad. So we're trying to figure out some Denver. Yeah, and some Denver. So we're trying to figure out where most people would be located, and that's where we'll do the training, and then then we'll figure out the travel after that.
Okay. Okay.
But for sure we can, if they're going to be working with the migrant programs that are connected with the hospital and Valleywide, then we can cover the training costs under the CCHN fund.
Mm-hmm. Okay. All right.
Anything else on that? Oh, I see something here posted. Greeley training will be in Loveland. So note that it's, she's talking that September 14th through the 17th, the Weld County training will actually be held in Loveland, September 14th through the 17th. Thank you, Ellen. We'll change that on our website as well. Any other additional items? We have, I think, a whopping, no, we're at 10:30, but anybody else or items you'd like to see on next month's agenda?
When is next month's meeting?
The next meeting is going to be Thursday, February 5th. It's the next slide, 9 to 10:30 a.m.
So are we switching to Thursdays?
Yes. In doing that doodle poll, we did get the consensus for Thursday morning as the most popular time. So that's what we're heading towards. And I know Connie gave a suggestion I thought was a good one to send out an Outlook invite to everyone for the year, which I'm about to do. I was really trying to clean up who was going to get these and really confirm what individuals and staff at what agency. So I think we're pretty well along the way there. Some of you responded. Thank you very much. And so that is the plan. On the first Thursday of most every month, 9 till 10:30. The only one that is going to be an exception besides January is July. It would be the second. And it would be the second Thursday in July. I want to say it was July 9th.
Yeah, July 2. We can either have it the 2nd of July or that next Thursday.
Yeah, and
everybody's already gone. Okay.
So, any other questions? There's that website again, but all righty.
All right, thank you. Thank you.
Thank you all. Thank you for bearing with me.
Sure.
Look forward to a good year. It's already started off great.
Thank you.
All right, thank you.